Okay, Juliana, you are on the air. First of all, I have to ask for your permission to share this video with other patients and other medical students, residents, nurses, or other physicians. This can be used so the other patient can view and share on the internet. What do you give us permission to do so?
Doctor, absolutely. If my story can in any way help anyone and give them that encouragement to take this leap, this is more than a step, because it's a changing experience, it has been for me.
Thank you. My next question for you is, prior to your surgery, you have a big neck surgery that we did, and I think, can you point to us your scar?
Yeah.
So that's the scar that you have over there.
This is a 6-month scar.
6-month scar.
Yeah.
And you will continue to improve. And can you share with us what type of symptom that you were having prior to your surgery?
Yeah, well, prior to the surgery, my situation had got very badly. I was having pain 24/7. I was unable to move my neck. When I did, or sometimes out of the blue, I would have my head was spinning. My arm was totally droopy, my arm was numb. All of this area was numb. I had no strength in my arm. My fingers were numb. But the pain was the most difficult thing to deal with because it was 24/7. I was under medication. I went through the injections. I went through the physical therapy, massages. I did everything that everybody told me to do with little or no relief. So, it was a very scary situation for me to take this decision. But after being in pain prior to the surgery, prior to getting worse, I started with the arthritis, then degenerative disc disease. Then in the last MRI, they said I had several bone spurs, but one of them was compressing my spinal cord, and that's why I was having weakness in my arm, and then the dizzy spells, and I was like, this can eventually leave me paralyzed. I can't do that. I'm still young, somewhat, but I have always been a very active person.
Right.
So I took the decision to come here looking for you because I live 4 hours away and I was not able to find a surgeon that would work with me. And the reason is because I am a Jehovah's Witness and we don't take blood transfusions.
That's right. So Juliana, after the surgery, did the surgery help you?
Tremendously, doctor, tremendously. Not only it released all that pressure of the pain, I regain movement in my arm and strength. I can move my neck with no spinning. The pain is almost gone. I still have some arthritis that I need to deal with, and that is something I can, live with exercise, with yoga, with Tylenol. I can live with that, but I would not be able to survive the way I was before. The pain was excruciating.
Thank you. Now, Juliana, you have to travel all this way because I believe in your community, some of the physicians have difficult time with Jehovah's Witness.
Absolutely.
Can you share with us your belief about Jehovah's Witness and the scary moment that you went through, and what you believe as far as transfusion, and what you will tell other Jehovah's Witness patients?
Yeah. Well, I have been a Jehovah's Witness for 32 years. And in the Bible, it counsels us against taking blood in any form or shape. So for me to ingest blood, eating it or putting it in my veins is the same thing. The Bible simply states to abstain from blood because we believe that the blood is the soul of the person, the blood keeps us alive. So that's a strong belief for me, and I had never had to face a major surgery. You know, the only surgery I had in my life was a tube ligation, and that was many, many months ago. So the fact that, you know, the surgery had to be, you know, the layers had to be peeled, there's major veins, you know, that ran. It was a very scary situation, but my faith was very strong. I was not going to barge, you know. I would rather have God's approval than extending my life through a blood transfusion. So, you know, it's not easy to find a doctor that will understand that and support you, but I was so blessed to meet you and that you work with me, because that was a turning point for me. You know, if you said, no, I can't do this surgery without blood, I would have to, you know, start all over looking somewhere.
Yes, thank you. Now, is it okay for other patient to contact you so you can share with them your experience from either religion or from a patient point of view, and how do they get hold of you?
Well, absolutely. They can, if my experience can help anyone overcome the fear or overcome the issue about the blood, yes, absolutely. And they can contact me through email. My email is Juliana with a double N. It's spelled Julianna, Trejos, Trejos @gmail.com. And I'll be happy to share this with anyone. You know, living a life of pain is no life. It sinks you in depression. You feel incompetent. You know, you don't enjoy life. You don't even enjoy laying down. And that was my case. I could not get relief laying down, standing, in any way. I went through several massages, injections, physical therapy. Nothing would get me rid of the pain. That's why I had to take this turning point decision. For me was the surgery.
Thank you. Thank you, Juliana. Do you mind if I share with them your x-ray? So
No,
I'm gonna
go ahead. Absolutely, go ahead.
I'm gonna turn to your x-ray. So let's see if I can pull your x-ray up. So this is actually a front view of your neck, and this is side view of your neck. Well, thank you so much, Juliana. You've been more than helpful, and I'm sure the other patient will really appreciate your experience.
You know, doctor, my thank goes to you and to Jehovah.
Appreciate that. Thank you. God bless.